Well, it's been more than a day since the bombshell interview by Prince Harry and Meghan Markle laid claim to a lot of problems with royal life. In the interview, Markle opened up about her own emotional health, saying she shared with a senior royal staffer her thoughts of taking her own life while pregnant with the couple's first child, Archie. The Duchess tied those thoughts strictly to her treatment by the royal family, but these thoughts are more common in pregnant women than you might think. According to a recent study published in JAMA Psychiatry, suicidal thoughts and self-harm in the year of and after giving birth nearly tripled among childbearing women between 2006 and 2017. Suicidal prevalence increased from less than 0.25% to more than 0.5%, and that translates to about 24,000 of the 4 million women who give birth every year. The greatest increases were seen among Black, low-income, and younger women. This morning, we're joined by therapist Carrie Craywick from Birmingham Maple Clinic. Thank you so much for joining us this morning.
Thank you for having me.
Tell us a little bit about how Meghan Markle opening up about her experience may help other women, because it seems like suicidal thoughts, at least among pregnant women, aren't all that uncommon.
Sure, they're actually quite common. Now, suicidal thoughts among pregnant women are like almost 1 in 20 women, so that's a very high number. She offers the opportunity for people to talk about it, to ask for help, to speak openly with their partners and their family members. Protective factors like having something to live for, like a new baby, like having the support of your family, really reduce the likelihood of actually carrying out a suicide. But the thoughts can be deeply troubling. A new mom can experience a lot of guilt and mixed feelings and even insecurity about her own esteem as a mom just for simply having those thoughts.
Right, and you think about what Meghan Markle was going through. She was pregnant, she was in another country far from home and probably felt isolated, but she also had some issues when it comes to race. She made those comments in the Oprah Winfrey discussion about how her son was being treated even before he was born. How do you think that can factor into someone's mental health and how painful it can be for a mom having to cope with dealing with the racial issues that she was facing?
Absolutely. I mean, moms are hardwired from the time of conception to protect their young, and that burden can feel overwhelming, especially when you're coming up against a wall as big as systemic racism, a system as big as the royal family. So it probably felt exceptionally challenging for her and overwhelming, and like looking at a big steep wall, might not know where to turn or where to go or how to overcome it. So it certainly was a great deal of stress.
And, you know, certainly everyone's mental health challenges are unique. What are some signs that people may need to seek help, or that they may need to get some help? And what's the first steps they should take if they feel like they're alone and need help and are having some of these thoughts of self-harm?
For the people who support these women, I think the first thing to do is when someone says they need help or when someone says they're having these thoughts, to absolutely take them seriously. To ask them, do you feel like hurting or harming yourself? Do you have the plan to do it? Meaning, have you thought about what you would do? And do you have the means to carry out that plan? Meaning, do you have the tools or implements or pills or whatever it may be to do it? If those things are in place, it's absolutely imperative to call 911 or go to an emergency room for a proper psychiatric evaluation. If you have any thought in your mind that someone's considering it, be bold and ask. It's the best thing that you can do for them.
Absolutely. Let them know that you care and that they're not alone. Carrie Craywick from Birmingham Maple Clinic, thank you so much for spending time with us this morning.
Of course, thank you for having me.
And of course, if you at home or someone you love is experiencing suicidal thoughts, don't hesitate. Pick up the phone and call the Suicide Prevention Hotline. That number is 1-800-273-8255. And we also have more resources broken down by every county in Metro Detroit on our website, covering everything from crisis hotlines to financial help. Just visit the Rebound Detroit section of WXYZ.com.